Welcome everybody. I'm Dr. Christian Furman. I'm the medical director of the Traeger Institute, and I'm filling in today for Dr. Fall. She's not able to be with us today, but we have our leadership team here, Dr. D'Ambrosio, Dr. Yankee Love, and this is our weekly get together for update of COVID and the Traeger Institute and the Optimal Aging Clinic. And so today we have a guest speaker. So I'm gonna first just kind of start. Oh, thank you. So here's the welcome slide. So yes, if everybody can keep their microphone on mute so we don't have the feedback. And then the best practices for doing this telehealth is, first of all, if everybody could type their name in the chat and their affiliation and what county they're from so we can keep track of our viewing and listening audience. And if you have a question, you can type it in the chat or raise your hand, and Justin will help us keep track of that. We are going to have question and answers, and so we'll alternate between questions asked via chat and the raised hands. Use respectful language. I think everybody's professional here. And if you are concerned about your health, we do have the ability to do telehealth in our office, and you can always give us a call at 588-4340, and we can help. We also have a website, and there's the hotline, the KY COVID. I'm sorry, maybe just go back one slide. I'll just say that number again, the KY COVID hotline. Let's see here. It's 800-722-5725. Okay, and then we can go to the next slide. And so if you're having difficulty with your sound, there's an arrow next to the microphone to test the system. So you can, next to the microphone, you can do a little up arrow and look at all the different options and hopefully figure out a solution. And I think that's, and then yeah, we talked about typing the county. We've had people from all over the state, and so we really appreciate people being here once a week with us. I look forward to these sessions and hearing how everybody's doing and learning from these sessions. So this is one of the positives of COVID, that we all get together once a week. So all right, I think we'll go ahead and start by me just kind of giving an update as the medical director on what's the latest. So the big thing is that we are starting to reopen our state, starting with healthcare first. And so I want to just kind of give that update. So our office specifically, our Optimal Aging Clinic, we started this kind of skeleton crew schedule, and we're keeping with our skeleton crew schedule. So our office is open in the mornings for labs, for drop-off labs, for urines, to have a provider see you in person. We're still trying to do everything through telehealth. We really don't want a lot of people in the office, so thank you for everybody staying home. All our patients we're trying to schedule through telehealth, but sometimes we just have to see a patient face-to-face, and that's what we're going to do in the mornings this week. Next week, we're in the mornings, Monday, Tuesday, and then Wednesday, we're in the afternoons. Our geriatric medicine fellows have their clinic in the Wednesday afternoons, and we need to get our fellows back to be able to see patients in person if needed. And then Thursday, Fridays morning. So it's Monday, Tuesday mornings, Wednesday afternoon, and Thursday, Friday mornings, starting Monday. So we'll always have a half day where we have a provider in-house if needed, but we're really trying to do everything via telehealth. And so we're still keeping all the same things, where the waiting room is the parking lot. People cannot bring visitors with them. You can bring somebody with you if you need that person, because you might have a disability or dementia or something like that. Otherwise, we don't want a lot of visitors. We are having everybody wear a mask. And if you have a mask that you have from home, please wear your homemade mask in, and you can keep that on throughout the visit. We are asking screening questions at the door. If you have a fever, cough, shortness of breath, chills, unable to taste, unable to smell, then we ask you to go back to your car. So please don't come to the office if you have symptoms. Just call us and we'll set up a telehealth visit. So that seems to be working pretty well. We've changed the flow of our practice. So it used to be people sat in the waiting room and then they went around to be roomed. Now we're not having the waiting room, so people are coming straight from, there's a box when you come in, and we want people to stay in this box, which is 6 feet away, and we'll ask the screening questions, we'll give a mask, and then we're just putting people directly in the room or going to your car. So the flow is just the opposite of what it used to be. And we are, abiding by the universal masking policy. And so it is a little bit, just bear with us, it is a little bit stressful for our staff to have to wear a mask all day, every day. but we are having our staff take breaks. Every 2 hours, we're asking people to take the mask off. The other thing I wanted to just point out is that we have the ability to do telehealth through other languages. There's a language service through telehealth. So please just call us and we can get the telehealth visit scheduled. So starting on Wednesday this week, the governor has announced that we are starting to do outpatient and ambulatory surgery and invasive procedures. So people are going to be available. Outpatient surgery will be available, and people are getting COVID tested before they have the surgery. And then that's phase 2. The next week after that, a week from Wednesday, is phase 3, where non-emergent inpatient surgery and procedures are taking place, but they're at 50% of the pre-COVID volume. And then phase 4, which is the next Wednesday, which is May 27th, it's going to be the same inpatient surgery, but the volume is going to be determined by each facility throughout the state. And so acute care hospitals have to maintain at least 30% bed capacity in both the ICU and total beds. So people are reopening based on this schedule, but only if you can meet this criteria that the governor put out. So not everybody can meet the criteria, but you have to be able to have enough PPE. You have to be able to have the ability to change your waiting room, to be able to change your flow, to be able to have enough sanitizers and enough hand washing stations. So all this is subject to change. And so if we see a big surge of COVID-19, then they'll change these guidelines. But the governor is asking everyone to use telemedicine and telework instead of in-person whenever possible. So we're trying to abide by that. And so I just want to talk about our telemedicine. It's going well. It's great. I mean, in geriatrics, it's like doing a home visit, and I see some providers on the call. So I know, Karen, I'm looking at you, Karen Krieger, so you haven't seen you before. And, we love doing home visits. So now we can do home visits through telehealth, which is like the gold standard for geriatrics, which is great. And I'll just give you one example that went well this week. I had a patient with dementia that was very paranoid. And I've seen this in the office where it's really hard for the caregivers to get the patient to come to the office because they don't know who I am and they don't want to see a new doctor. They don't want to leave their house and they just won't come in. We have to try to be creative about how to get people in the office. Well, telehealth, they don't have to leave their home. So, I can, and a lot of times when the people in the office, the caregiver wants to talk to me privately, and it's really hard to kind of work out a way to talk to me privately without the patient being paranoid. So with telehealth, it works out great. You can just say, oh, there's a bad connection. I got to go to the next room. And, then they can just go to the next room and talk to me privately. And I had a whole conversation with the caregiver to figure out what was going on. But I had to see the patient. So at the end, and they just introduced me as her friend, and this is a doctor, and it was very casual, and the patient was so excited to see me, and it went great. So I would encourage telehealth. It's great. It still has its own challenges, like everything. The technology is not 100%. It's always a glitch every time, but it's worth it. It's worth the safety to keep people at home. So that's my updates. And then I'll be available for questions, at the end and during the chat, but I want to introduce our speaker for today. Okay, let me just get to my next slide. Okay, so the title of our session today is Being a Savvy Social Media Consumer During COVID-19. And so we're going to have Dr. Karen Freeberg, who's a PhD. She's an associate professor in strategic communication at the University of Louisville, where she teaches, researches, and consults in social media strategy, public relations, and crisis communication, which is what we need right now. And Dr. Freeberg has written several books, including The Roadmap in Teaching Social Media and Digital Media Writing for Strategic Communication and Social Media for Strategic Communications, Creative Strategies, and Research-Based Applications. And so Dr. Freeberg has also worked on several consulting opportunities with General Motors, Adidas, Adobe, Hubspot, the Breeders' Cup, DHS, CDC, Hootsuite, Colorado Ski Association, and Firestorm Solution. She has coordinated and advised various companies on the areas of social media pedagogy and certification programs. And we are really happy to have her with us today. So I'll go ahead and turn it over to Dr. Freeberg.
Thank you so much, Christian. It's an honor to be here. I'm not at the University of Louisville. This is just
I love your background.
I definitely love the Zoom backgrounds. And so there's been a lot of things in light of COVID-19 that have brought some creativity, but it's an honor to be here to talk about social media, which is a huge part of what we are dealing with right now with COVID-19. And so this past semester teaching with my classes in social media, I was able to apply everything that you mentioned in my bio: crisis communications, PR, strategy. So what I wanted to do is, first off, thank everyone for allowing me to be here. And I definitely want this to be a starting off point. So if there's anything that I could answer, after the short talk, or if there's any additional resources that I go over today that you would want more information, I'm an open book. I'm here as a resource. So I'd be more than happy to share anything, that would be helpful for you guys in this area. So social media, definitely, in terms of being a savvy social media consumer in light of COVID-19, what I think this crisis has really brought forth are new challenges. And so with crisis communications, we talk a little bit about the different types of crises that you are involved in. So what we are seeing here with COVID-19 is a very unique blend of a crisis, because it is a traditional crisis. It is a pandemic. It is a health crisis that all of us are experiencing globally, but it's also a social media crisis. And so a social media crisis is an incident that happens on social. And so what we have to kind of readjust our thinking, when we're looking at classifying what COVID-19 is I would say it's both a traditional crisis and a social media crisis, because there's a lot of misinformation, there's a lot of fake news, there's a lot of discussions that are happening online that have kind of spurred a lot of fear, a lot of anxiety. And so this is a case that I would really kind of classify it as its own. And related to how social media plays into crisis communications, I think it offers a lot of different challenges for all of us in society. Anyone can document and create a story on social media, which is great. You have a lot of creativity, and I always tell my students, this is great for normal circumstances, but when you're in a crisis, anyone can create a story. So there's been a lot of fake images. There's been a lot of news that's come out about, like, no, this image that was taken at the beach was not actually taken at the beach at this time. It was actually taken a few years ago. And so people are like, well, which information, which sources do I trust? And so that's raised a lot of concerns, from, various officials to even crisis communication strategists. They're like, well, how do we inform the public on who to trust as a resource? And so that was actually my dissertation, was kind of figuring out message credibility, message strategies during food crisis. But I think news and communities are also interconnected. We are pretty much attached to our phones. Social media use has gone up dramatically. One resource that I've been looking at extensively has been reports coming up from a social listening tool called TalkWalker. And TalkWalker actually has daily reports on what's happening in COVID-19. And so it's a free report, which is, in my book, always good to have free resources for us to consume, to kind of be aware of. So that is one report that I would check on a daily basis. They update it and they basically say, okay, here's how many people are on, here's how many people are talking about COVID-19, and here are the areas that they're talking about. So it goes into a global report, but that also kind of breaks it down into countries, and specifically here in the US. So I think it's important for us to be informed on what people are talking about on social. And I always tell my students and brands that I consult with, it's an online focus group. And for us to be informed, we need to know what people are talking about, but also who are individuals who are driving the conversation. So are the leaders, the credible resources that we have in the health profession, the government, are their messages getting across to the public? And if not, what can we do to make sure that they are getting the information out and being a resource, a trusted resource online? And I think the other thing that we have to kind of be aware of here too, related to COVID-19, is that crises have no boundaries. Every part of society has been impacted by this. I mean, I work in the education sector where our classes have all gone online. And so this is something that this crisis has impacted everybody in a variety of different circumstances. And so when we are communicating and looking at kind of future trends related to COVID-19, I think it's important for us to be a savvy social media consumer is to understand the context. So I think it's important for us, again, with social media, it is basically an online focus group. We have to kind of know the context of the situation. Like, is someone sharing something? What is their past history on social? Like, what are some of the things that they are basically saying in context? So are they stressed? Are they anxious? What are ways in which we can respond or help them, in a time of crisis? And I think it's also important for us to think about preparing messages and to understand like the behavior that people are going through. So I love the homemade mask recommendation. I think it's important for us like to kind of to be a savvy consumer of social media. We need to kind of look at what people are talking about and say, okay, people are talking about masks. How can we make sure that we are communicating where people can go to either build their own mask, or develop their own mask, buy their own mask. So we want to anticipate, based on listening on social, what people are concerned about. And then I think the other thing that again, with social media, it is an online tool for us to kind of see what people are talking about. I think the best way for us to be informed is to listen. See what people are talking about, set up, there's a couple of really great social listening tools. So TalkWalker, as I mentioned, it's more of an enterprise tool. But if you have a social media dashboard, like Hootsuite, for example, they do have a free version. Just set up keywords that are associated with your county or your community. And then you'll be able to kind of see what people are talking about. So then if anything comes up that you're like, okay, that's not the correct information, or that's, not what people are talking about, then you'll be able to inform and educate audiences. And I think the other thing we have to kind of be aware of too is just being able to give back, to the community and making sure that we are providing them with resources and educating them about COVID-19. There's a lot of information like, okay, these are the symptoms, these are where you go for information. And so I think for us to be a savvy consumer of social media, we have to understand where we are going for, our trusted resources, the, CDC, the Kentucky Department of Health, our own community, and making sure that we're creating content that is easily interpreted and easily accessible to all of our audiences. So videos are great, but you might want to think about infographics, visual representation, saying, okay, this is how how to wear a mask properly. So there's been a lot of reports that I've seen recently that people say, well, people are wearing masks, but they're not covering their nose, they're doing it all wrong. And so I think it's important for us to kind of look at these trends and say, okay, let's create content and inform our community. These are the proper steps that we need to go forward and do. But I think there's also a lot of, really good research that's coming out related to the trends that we're seeing. A lot of brands, a lot of individuals are coming up to the plate, sharing, hey, here's our policies on what we're doing. A lot of grocery stores have said, okay, here's our policy in terms of how we're addressing this. And so they've been communicating that pretty regularly on social. But one of the things that I think sometimes in social media that we forget, like one channel that we seem to forget a lot as being kind of grouped into social media is email. Email is a great tool for us to utilize newsletters, updates, letting people know, hey, if you have a question, we're going to have this Facebook Live to be able to do a Q&A, that we're able to answer any questions that you have regarding this. And so what you want to do in any type of crisis situation on social is, one, be present, and to make sure that you are there if anything happens, like people have concerns. And if anyone has uncertainty, anxiety, and not enough information, that's kind of where fear kind of percolates. And so if for us to be a savvy consumer, we need to go to places that are offering those services and saying, okay, every, time of day, whether it's 5 p.m., 3 p.m., we're going to have a Q&A with our leadership. We're going to have a Q&A, answer any questions. So you want to kind of be present. And it's surprising still in 2020, in light of a global pandemic, there's been some cases where I've seen just complete silence because people are like, well, we don't know how to talk. We don't know how to present, on this subject. And I think you just want to reassure people that what's going on. But I wanted to kind of also talk a little bit about some other case studies that you might want to look at as, kind of examples of brands in this case that have done really well in reassuring and, providing their consumers to be social media savvy in their line. I would recommend looking at Adobe and so Adobe and Google, have been really good. So Adobe, of course, is the technology platform, but they have a designated site on their corporate page, where they basically have all the information about what they're doing, but they have everything that's available on how to, keep track of, the COVID-19 on social media. So especially for us in the healthcare industry, we want to make sure that we are directing people to where they need to go in terms of getting more information across the board. And then Google, I think, has been really proactive in making sure that each of the government organizations and key states have their own search terms. And so that is something too, in terms of being, really savvy in social media. You want to make sure that you own is not only your keywords, in any type of post that you do on a blog or a website, but also your hashtags on social. So if you're using that on Instagram or if you're using it on Twitter, you want to make sure that you are basically saying, okay, this is the hashtag that we will be using to follow this conversation related to what we are doing. So you see that you have, of course, COVID-19, but you also have some states that have designated conversations pertaining to their state with their state lettering. So that basically is one way to kind of say, okay, we'll follow this conversation to get relevant information for your community, because otherwise, if you look at COVID-19, you'll get billions upon billions of updates. And so I wanted to give you guys some resources too before wrapping up, and then I'd be more than happy to answer any questions. Again, Talkwalker, TALKWALKER. So it's a social listening tool. Highly recommend looking at it. But they do have their daily COVID-19 reports that you can get emailed to you. So again, it's a big picture of what people are talking about, but that might be informing you, saying, wow, people are talking about this particular trend on this day. Maybe this is something that we need to kind of let our audiences know what to do, what to prepare for. Facebook, Twitter, Instagram, all have designated places. If you sign in on their apps, they basically say, okay, here's COVID-19 resources. Here's what you need to know. So it's already in prime real estate on their apps. I would recommend also reading a book by Melissa Agnes. It's called Crisis Ready. And it's a great framework of a book, but it really is geared towards social media. So I really love it. Melissa's done a lot of work with government agencies, but Crisis Ready is a great book. And then the CDC also has some training in crisis and risk communication. They actually have a free certification that includes, a lot of social media practices. So if you're looking for additional trainings, I would highly recommend looking at CIRC. It stands for Crisis and Emergency Risk Communication. So it does have several modules on how to prepare, how to train and, articulate messages through social media. So that would be something that I would definitely look forward to. But I definitely want to make sure that I take a moment, to answer any questions, or if there's any other ways in which I could help, you guys out, from a social media perspective.
Thank you so much, Dr. Freeberg. It's really, there's so much with this pandemic, it's hard to think of all of it. So I'm glad someone thought about social media as a topic. Yeah, you're right. It's a big issue. So other questions for Dr. Freeberg? And yeah, Justin?
Dr. Freeberg, I just put in the chat Talkwalker, Social Listening, First Choice of Global Brands, and Crisis Ready by Melissa Agnes. Was there another resource that you mentioned that I can put in the chat?
Yes, the Crisis and Emergency Risk Communication Certification, or otherwise known as CIRC.
Can you slow down just a little bit?
Oh, sorry.
That's okay.
It's Crisis,
okay,
Emergency Risk Communication Certification.
Thank you.
And I know Dr. D'Ambrosio, Dr. Joe just asked a question, but I want to clarify the spelling of your name. So I'm going to put your name in here so everybody can see it. It's Karen, K-A-R-E-N, and last name is F-R-E-B-E-R-G. Is that right?
That's correct.
PhD at U of L. So go ahead. What was the question that Joe asked? On a daily basis, how can we ensure that we are not listening to fake news?
Well, Yeah, I mean, it's kind of challenging. That's a great question, just because when you think of everything that kind of floods into our feeds, you have to kind of really look at, okay, is this real? Is this not? And so what's been really good is that there have been, I know NPR has a good kind of checklist of like saying, okay, how to identify if something is fake news? And so this is something that I've had to share with my students as well. And I would just basically look at, when you're looking at sources, I think the thing that kind of strikes up for me is like, I look at, whether it's Facebook or Twitter primarily, I look to see, okay, are they verified? And I also look at what has been their timeline. Like if they've been just for years, just kind of saying, sharing just fake news, I'm like, okay, this is not necessarily a trustworthy source. So you kind of have to go through various steps of kind of identifying which sources are real sources and which ones are fake. And so I would also say too that I try to limit my time in terms of how much news consumption that I get, because right now, like there's so much going on with COVID-19. And I think it's important for us to kind of take time to be informed, but also look at the sources that we're kind of seeing kind of percolate in our feed to kind of identify, okay, is this a real account? Is this something that I can trust? And so if you feel like, if, all of these categories and checklist items are, approved, you're like, okay, this is a source that I can definitely follow. But yeah, it's definitely a challenge.
And I noticed,
oh yeah, Mary has a question. Is Talkwater the source that also included local information? It gets to local, but that is something that if you are interested in like real local information, you might want to contact them. They kind of do more of like a blanket, like US based trends, but you can they're a powerful tool that like, if you wanted to look at just Jefferson County in Louisville, Kentucky, they would be able to do that. So, I mean, that's one of the great things about some of these social listening tools is they can be very specific in terms of the location that you can find and, kind of follow these various trends.
And Joy Tabler asked a good question. Justin, can you read it? Okay?
Yeah. So Joy asked, or she acknowledges one of the biggest challenges she has in working with seniors in their home is their feeling of intimidation about technology. Even her parents, who are 77, need sources to learn and become more comfortable with using their laptops, smartphones, and tablets. Do you have any recommendations on where they can go for practicing use of Facebook, Twitter, et cetera? They're watching TV all day and not able to join webinars to hear and learn from approved sources.
Yeah, no, I'm really, that's such a great question, Joy. And what's great about social media is there's so many resources out there. So I'm going to actually type this in. There's a great company called Hubspot, and that's actually one of the companies that I worked with for their educational programs. So they actually have designated classes, webinars, and like very short class segments, like, maybe 3 or 4 minutes per lesson, just talking about Facebook, Twitter. But then if they complete those, and again, what's great here too is they're free. That's always good. So if you look at Hubspot Academy, there's a wide range of platforms, classes, and certifications that you can go through. So basically it's just walking you through like, okay, here's Facebook, here's Twitter. And then there's some other advanced videos that say, okay, this is fake news and social media here, or here's social media strategy, or here's how to, the ethics of social media. So there's a wide range of educational resources that are available to everyone to, look at. These videos are free. But yeah, this would be really something that if, people are curious about, some of the best practices or some of the features, this is, at their fingertips. And so, you can watch these videos on your phone, your tablet, your computer. They're very well accessible. But these are things that I, of course, incorporate in my classes at U of L, but these are great resources. I would also recommend too that Facebook, I'm going to put this too. Facebook also has their own education kind of brand under the main parent brand. It's called Facebook Blueprint. So this is very much geared to just Instagram and Facebook and their other platforms. So this is a little bit more advanced than what HubSpot offers. But if you are looking at best practices, and creating content to reach your audiences, to kind of look at, okay, like, should we do targeted ads, sponsored posts, or how do we best effectively get our Instagram messages out? Because that's where, you know, a lot of people are going now. Facebook Blueprint has, again, tons of lessons, tons of video segments on all of these topics.
So Dr. Freeberg, somebody sent me an NPR story from October of 2019, Fake News, How to Spot Misinformation. Is that the article that you were referring to?
Yes.
Okay.
And so maybe we can put,
I'll ask them to share it.
Yeah, and I think Natalie, you know, Natalie Pope is our marketing person that does our website. Maybe we can put these links up there, the Hubspot Academy, and, you know, Justin, you can put this article, because I think, you know, we're trying to have our website be a resource for people too. So thank you for those resources.
Yeah.
I have a question too.
Darius had one. I think, yeah, there's been a few other media outlets that have kind of taken the leap and say, okay, this is how you go about and identify this. And I think that's really important, you know, because I think, you know, some of us can say, oh yeah, I like it, this looks like a bot, but then you've seen some very sophisticated fake accounts kind of, you know, basically come up, and you're like, okay, that looks like a real person. And I think it might have been a study out of University of Southern California that kind of looked at fake bots and their impact on, you know, trustworthiness. And so it's a real, I mean, that's one of the big challenges that I see in social media crisis communications, is that these bots look like people, they, you know, look like a real account, but they're really not. And so it's really important for us to kind of inform our audiences on what to look for. And unfortunately, one of the things that happens is every time that a new platform evolves or a new feature comes up, the bots follow. And so it's just, we have to be diligent on this to be best prepared.
And Dr. Freeberg, are we saying your name right? Is it Freeberg?
Yeah, it is Freeberg.
Okay. And also, when you say bot, I'm sorry, it's a robot. When you say bot, it's short for robot, right? Which is a fake thing.
A bot is a program that basically is not a real person, but it's programmed to basically illuminate that you are a real person. So you see, I mean, there's a lot of these bot forms where essentially, you know, they have millions of phones essentially. And so basically all they do is they're programmed to like or comment to kind of, you know, fake the algorithms like on Twitter or Facebook to kind of help certain accounts get more awareness and prestige, you know, not prestige, but kind of more traffic to their sites. And so there's been a lot of people that have bot followers or bot bots, you know, to kind of be programmed to kind of create the illusion that they're credible or they're influential. So it's been a huge issue, you know, across the board, and not only in crisis communications, but also on marketing and social media side. So yeah, a bot, and anyone, you know, unfortunately can create them and kind of launch them out. And so that's been a big issue that we've seen right now with COVID-19, is that there's been a lot of bots that have been, you know, kind of supporting one way or the other, that kind of been trying to ignite certain actions to happen offline. It's like, oh, this is, you know, what the view that we're supporting it, but you know, you look at the bots that are there, they're not real people, and you're like, okay, who's really trying to manipulate the perceptions of what's happening online? So, I mean, again, I think if you guys were able to dedicate a place on your website for just saying, okay, here's how to identify, you know, a bot, here's how to identify fake news, you know, just, I think that would be tremendous for your community.
Wow, that's fascinating. I knew a little bit about that, but I didn't know those details. And also, I'm on my Facebook account. I just saw that they're going to start checking to see, is this real? I mean, that they're going to check to see the country of origin of these Facebook messages or something. I don't.
Yeah, so Facebook, Instagram, and Twitter, I mean, a lot, like they've had a lot of really, they've had a lot of news related to, you know, populating, you know, like, here's what we're doing to make sure that bots are, you know, like if you have a bot, you're not going to be able to be on the platforms. But again, people come back. But yeah, there's a lot of, you know, actions that these platforms are trying to do. It's just hard to keep up, you know, at a scale. And I see that Barbara mentioned in the chat, yeah, scams have increased 40%. Absolutely. Yeah, I would definitely say don't accept friend requests, you know, that, you know, look suspicious, or if you run into a situation where someone else is trying to impersonate someone, you know, and your colleagues, you might want to report that profile. I would say one of the best practices that I have, like on Twitter and Instagram, is like as soon as I see a new follow, like that looks spammy, I block them, you know, and so that's the best way to protect yourself, is to not let them have access to your profile, because they could potentially use your information to create, and basically be a bot, themselves. And so I actually had a friend that found out the hard way that someone followed them on Twitter and created a whole fake account and used their profile and everything, but it was not them on Twitter. And so they had to report that back to, Twitter. And so there's reporting those bots too is a good thing too, to let Facebook and Twitter know, like, hey, this is an issue. And so then they, of course, can take that down and then, of course, report the user for violating their terms of service. And so I think the big thing that I would recommend to everyone is due diligence. Don't open any links or messages that you don't know who that's from, because I've seen a lot of cases now with Facebook Messenger. A lot of people have been trying to send stuff through Messenger, but also Instagram stories, DM, so I think the big thing is being diligent, but also, again, providing maybe some guidelines and saying, okay, here's what you need to do to protect yourself in a scam like this.
Are there any more questions? This is really helpful information because I think people maybe have more time on their hands. I don't know. There's a lot of this going on now. And older adults are for sure, at risk for these scams in general. I mean, there's scams about antibody testing. There's scams about, the swab testing. And so if it looks too good to be true, it is too good to be true. Do never pay cash for anything.
Yeah, I think, there's so many scams. I mean, like fake protection, I've seen that a lot, like on Amazon too. I know Amazon's been trying to kind of combat that too. And so, you've seen a lot of fake accounts, promoting, we have, protective, gear, it's, and it really isn't. And so anytime you see any of those kind of like ads or posts, just report them. I would say just to be better safe than sorry, for sure.
Are there other questions for Dr. Freeberg? It's a great topic.
Yeah, I might put my email address here too, just in case if anyone has additional questions or if there's other resources that you would like me to share with you, just send me a note. I'm pretty much attached to my phone and social media now. So if anyone wants more information, I'd be willing to help out.
That's great. Great, thank you so much. And I meant to say this earlier, and then Natalie Pope in the chat put the article that Justin mentioned about the NPR article, Checklist for Identifying Fake News. And then Natalie Pope also listed, we have a recent blog on other scams as a general reference, right? There's lots of scams going on. Mm-hmm. There's always scams, but there's more so, I think, during this pandemic time. And then one thing I meant to mention earlier, and I forgot to say this, Sunday is Mother's Day, and May is Older Adult Month, and Tuesday, May 12th is International Nurses Day. That's the birthday of Florence Nightingale. And next week, well, starting March 6th, which is tomorrow, actually. Today is Cinco de Mayo. Happy Cinco de Mayo. But starting tomorrow through the 12th is National Nurses Week, which, nurses are on the front line. And then next week is National Skilled Nursing Week, which is May 10th through the 16th. And nursing homes are our most vulnerable population. And so I know I'm medical director at Presbyterian Home. And so to kind of honor all this and to have some kind of organized thing around Mother's Day, they're doing a parade next Thursday at 2, May 14th. And, it's a way for the older adults to kind of get out of their rooms for once. Everybody's going to be 6 feet apart, wearing masks, all the proper techniques, and have like a parade drive-through for the area. So I would just encourage you during this month and next week and all the time, but for sure during this month, to just reach out to the nursing homes and, see if they're planning anything. You could be part of a parade, or you could be part of some, dropping off cards. Some people, are mothers but don't have any kids that would be able to send cards or drop off cards. So it's just a big week, a big day celebrating nurses, celebrating the long-term care industry, celebrating mothers. So if anybody knows of other ideas about that, let us know. And then there's some more questions. So Justin, you want to go ahead? Yeah.
So I just want to remind everyone, if you have not put your county in the chat, if you could please do so. And that if you or someone you know are providing care to a loved one who is 60 or older, the Traeger Institute has a free caregiver program. The caregiver team can provide referrals to resources, training, support groups, and individual counseling. The caregiver program team can be reached by calling the hotline 588-3322 or by emailing tragerinstitute@louisville.edu. And then Joy chimed in about International Year of the Nurse. So yes, we appreciate everything they do.
And then there was a question, as an expert, this is from Mary Kay Fledgy. As an expert, what is your biggest fear with COVID-19 regarding social media? So maybe Dr. Freeberg, you could answer that.
Well, biggest fear. I would definitely say kind of, the circulation of, scams and fake news, because I think already you have everyone's stress level, really up to here. And I feel that it can be used in a very negative way. And even as someone that loves social media, I understand that there is definitely a dark side to it. And, it's important for us to kind of have balance. And so I think my biggest fear is that just kind of, the amplification of, kind of fake news or scams, really kind of make a negative impact on what's really, real, what's happening, and kind of, not getting the, true information coming out. So I do think that that's one of the things that is scary, that we're seeing right now. But I think that with some of with education, kind of being informed and kind of making sure we are advocating for the sources that are providing the right information, we can kind of, combat the information that is not true or trying to do harm on us. So, but yeah, that's my biggest fear.
And Barbara Gordon asked me a question. I think it's okay to say this publicly, but there's information out now about the virus mutating. Can you speak to this, or would you rather wait? I have not heard about that. I mean, there's so much, we just don't understand the virus that much. We were understanding more and more. So I think that's why we're able to kind of start slowly reopening states and reopening healthcare, because we do understand it a little bit more. But yeah, that's the whole thing, is that once you've had the coronavirus, you're not immune necessarily, because we don't know, can it come back? Can it mutate? Could you get it again? So, I think people should have a healthy fear. I mean, we don't want you to be so afraid and paranoid that you can't live your life. But, until we really understand, till we have a vaccine, till we have better treatment, you just have to really wash your hands every time you touch something, stay 6 feet away, wear a mask. Don't go out, you do telemedicine, don't go in these social gatherings, and follow the governor. I mean, I think our governor has really done a good job of, following science. And so, just be smart about it and follow the guidelines and don't take unnecessary risk. And Barbara, what are some strategies for spotting bots in your social media?
Yeah, that's a great question, Barbara. I just put in a blog post specifically on Twitter, but this could be pretty much anywhere across social media. So there's a couple of things. One big thing that, basically comes across is if you have a username and they have a ton of, numbers after it, if it's like Karen 1 2 3 4 5 6 7 8 9 10, I'm like, okay, that's definitely a bot. But some bots can be kind of tricky. So then I look at, okay, when were they, when was the account created? And if it was created just now, then I'm like, okay, bot. But what you also want to do too is look at their content, look at their tweets, look at their posts. If it's on Facebook, they probably have no mutual friends that, basically they, share with you. So that's a clear, if they don't have a lot of information, or if their pictures are just grainated and just, doesn't look real, or their name is kind of okay, this doesn't make sense. I mean, there's a couple of, warning signs that you can kind of look at here for identifying bots. But yeah, there's a ton of resources out there on how to identify bots. So this one just this blog post focused on Twitter, because I would say that is probably the most prevalent, but Instagram is definitely right behind in terms of bots and fake accounts. So if you kind of look at some of these strategies and what they propose, how to identify them, basically, this is a nice basic checklist that you can apply for all the other platforms out there.
Oh, that's really, really helpful. And also, Justin and Natalie and everybody, this is being recorded. Is this also on our website? Is that right? So if we want to refer people, yeah, this is going to be recorded and put on our website. So like Joyce said, I'll have my mom watch this, because I think everybody needs this information. It's very helpful. Okay. What other questions or comments or things we need to think about around COVID, around telehealth, around social media? I do want to say, before I forget, so next week we already have our speaker lined up, 10 o'clock every Tuesday. So Tuesday, May 12th, Victoria Elridge, who's the Commissioner of the Department for Aging and Independent Living, and she will discuss senior services available in the community and the work we are doing at the Department of Aging and Independent Living to ensure long-term services and supports are available to seniors, including in-home services, meals, and person-centered services. So that's a great resource, and we'll hear more about that next week. And then Natalie said we record the sessions and have YouTube links on our website, so that's really helpful. And our website is www.tragerinstitute.org, and then /COVID-19-resources. Yes, and so I think older adults themselves, if you know older adults, next week would be a great time for the older adult themselves to be on this session. So we can encourage older adults to log in and be part of this once a week gathering. What else? Any other questions?
Can I ask a question?
Yeah.
Dr. Freeberg, so you use the term fake news.
Mm-hmm.
And I think that it has been weaponized in a certain sense to discredit legitimate journalism. Can you define for the lay public how you would define fake news?
Yeah, no, I'm really glad that you brought that up because, yeah, I mean, when you think of fake news, like you feel like, oh, that's, like people assume, oh, it's information that I don't agree with. But no, like I would classify fake news as points of that are being communicated that are not true, basically information, whatever side of the, standing you're at, like the information that is being said is not verified. It's not gone through the rigorous journalism practices of confirming the information. And so that would be kind of my definition, like one of the things that I've had a chance to do, like in my PR education, is I've had to take a lot of journalism classes. So I know kind of like how journalists have to go through. It's like, okay, you vet the information, you get your credible sources, you articulate the points. And I think that's, the process too. And I think for the common public, they may not know the steps that journalists go through, to kind of check out the resources and verify the information as being true. And I think if someone, what we've seen is if people don't like a certain perspective being shared, they're like, oh, that's fake news. And they kind of blanket like that. But, really, truthfully, it's fake news is information that has not been verified. It's not been checked. It's not from credible resources that have gone through the rigorous process that you would see from a journalism perspective. And so that would be my definition. But yeah, I mean, I think like there's been several terms like that in the social media circle that have been not only been weaponized, but they've had kind of this tarnished view. Like I would say influencers are classified because everyone, when I talk about influencers, they're like, oh, Fire Festival. And I'm like, well, there's good things, that influencers have done, but everyone kind of refers to that catastrophe that happened on the island. And so people have kind of been swaying away from influencers as a result. So I think with fake news, it is definitely when you say it, people like have so many emotional attachments to that word that either like, but if you say information that's not true or that has not been verified or not gone through credible, like the rigorous credible sources, people are like, oh, okay. But then when you tie that to fake news, they're like, that's fake news. And so that's just my 2 cents on that.
That's helpful. Yeah, that's helpful. We do have a minute. Can you explain what you were talking about, this island or fire or whatever you said? I didn't know that reference.
Yeah, so so the Fire Festival, actually, if you have Netflix or Hulu, here's a homework assignment. So I tell my students, please do not do this. I do not want to talk about this in class. But Fire Festival was actually created by 2 people. One of them was the rapper Ja Rule. And what they were trying to do was make a tropical version of the music festival Coachella. And so they had all of these influencers, like from Kylie Jenner to, all these models promoting the Fire Festival as being like this luxurious getaway music festival on this tropical island in the Caribbean. But it was like a complete sham, like it was, they did not have any luxury villas when people got there. Instead of having like you know, this elaborate food course meal. They had cheese sandwiches. I mean, but Netflix has an excellent documentary on the Fire Festival, but it's one of those cases that people have said it really damaged influencer marketing. To the point where people are like, yeah, I don't trust these individuals. We're misleading us. And, but yeah, it's one of those cases where even for myself working in crisis communications, when I think I've seen it all, I look at that case, I'm like, well, no, I have not seen it all. So if you want a good documentary to kind of see how something could come about that way, I mean, it's a fascinating case study that will be talked about for years in classes.
Well, that's good. Yeah, I don't know about all this great social media stuff, so thank you. Okay, and what else? I think that might be it. Any other questions, Justin? Have you seen anything else? Oh, and Karen, thank you. You put the Fire Festival. I was spelling it wrong. So it's FYRE Festival documentary on Netflix or Hulu.
Yeah, Hulu also has a documentary too, if you have Hulu.
Excellent. All right. Well, everybody have a wonderful Mother's Day, or celebrate your mother on Sunday, and celebrate nurses, and celebrate the long-term care industry, and celebrate Older Adult Month. And so next week, we'll all be back at 10, and wish you all well. Stay safe, wash your hands, wear your mask, stay 6 feet away. Be good.
Thank you.
Bye. Thanks so much.